Good evening to everyone and welcome to today's wonderful evening of January 1st, 2020. Om Rishi Roshan Yadav, Maulika, Ashwin Maran, Rehana, Nagredi Sab, Rahul and many more who are all online across the country. Last 30 hours before you great warriors go to the battlefield, I thought, let me give the best of myself to all you guys, assisting you every minute for the next 30 hours and give you a great farewell to the NEETPG 2020 exam. Thanks for joining the game. Very happy New Year, Prasoon Vaidya. Please drop a line in your WhatsApp and Telegram, Facebook, in all areas that the live class has started. So I had a choice between single liners, 10,000 single liners versus solving the FMGE paper. I thought, let me first quickly finish this FMGE, and single liners are after all nothing but MCQs converted into single liners. So that's the reason let us take a game and take a race of the most recent question papers. Now doctor, keep punching your answers. Nasal carriers of MRSA. We have about 300 MCQs from the Foreign Medical Graduate Exam MCI screening test June 2019 question paper. So doctor, it is the mupirocin which is being used. So you should remember the antibacterial agent mupirocin. It is active against the gram-positive organisms, Staphylococcus, Streptococcus. It is available as a nasal ointment, and the nasal carriage of the Staph aureus is annihilated by using the mupirocin, is what you need to remember. Which is that long-acting insulin that will never attain a peak. That's called peakless insulin. Come on, punch your answer, doctor. Yes. Punch your answer. Most of you are correct. Insulin glargine. So if you happen to take the insulin glargine serum concentration, it will be like this, without a peak, whereas other insulins will have a peak. Any insulin which has a peak, there is a great risk of hypoglycemic episodes. That's the main problem. Gray baby syndrome, chloramphenicol, everybody on the planet knows this. Most common cause of the blindness in India, it is the cataract, which is the most common cause of the blindness. Which diluent will you use to reconstitute the BCG vaccine? We use the normal saline to reconstitute the BCG vaccine. Gillutam. So these are all almost biscuit questions. Very, very easy questions. Once more, NEETPG also. If you prepared well, 200 questions will be like a skating match. Very easily you can be able to win. So keep actively punching the answers, and some points that come to your mind, please punch. So 5-lipoxygenase inhibitor. Fulminant hepatitis is caused by two things, hepatitis B, hepatitis E, both of them. But in pregnant women, fulminant hepatitis is due to hepatitis E. But if the examiner asks you a question, most common cause of the fulminant hepatitis, between B and E, which is more common? B is more common. So B is the most common cause of the fulminant hepatitis, but fulminant hepatitis in pregnancy is hepatitis E, is what you should answer. How do you confirm the diagnosis of the gout? You will look for the urate crystals in the synovial fluid, which is considered to be the most consistent, diagnostic finding. Sarah Khan rightly says, E for expectant mothers and E for epidemics about hepatitis E. Whipple's disease is caused by Tropharema whippleyi, which is also acid fast. Acid fast is what you need to remember. Now, what is the serological marker suggestive of ulcerative colitis? Punch your answer, doctor. One of you, at least one of you, mention the question number and punch so that you're all in the stream. Very good. It is Pianka. So you should remember Pianka PR3, proteinase 3, ulcerative colitis. Whereas ASCA, immunoglobulin G and IgA, ASCA, that is the one which is for Crohn's disease, is what you need to remember. So Crohn's involves whole GI tract, it is discontinuous, transmural, it can lead to extraintestinal manifestations, colorectal malignancy. They're all the true statements. So Pianka for ulcerative colitis, ASCA for Crohn's disease. Once more, without a question on inflammatory bowel disease, NEETPG hota kya? Nahi hoga, nahi hoga. So ulcerative colitis versus Crohn's disease, 100% you have to be sure. Smoking is the most common risk factor for which type of emphysema? Beautiful question. Come on, punch your answer, doctor. What is your answer? Very good to see 91. Today we should touch 300 students, doctor, before it is 2 a.m. in the morning, right? Yes. So, I'm getting a lot of WhatsApp requests from the students that, sir, tension aa rahe, they are feeling very anxious. So always, the best way to kill the anxiety and tension is to sit and study with a group of friends. That is the only curative and palliative solution for killing the anxiety, doctor. The more we feel we are anxious, the more it will keep growing exponentially. So no worries. I am there every minute to spend along with you guys to do this high yield MCQs of the most recent exams. 2019-18 में जो भी एम्स, PGI, FMG, NEETPG, ये क्वेश्चन बैंक अगर हम डिस्कस करें तो that's more than enough. Once more the question is going to come from that. Centri-SNR, doctor. Absolutely, most of you are correct. I'm so happy. So doctor, emphysema can be centri-SNR, can be pan-SNR, paraseptal. Centri-SNR is most common type. Proximal parts of the SNI are involved, that is the respiratory bronchioles. Mainly upper lobe. Mainly upper lobe. Emphysema आ गया तो कहाँ जाएगा? ऊपर भगवान के पास जाएगा. क्यों आएगा? Emphysema smoke करे तो smoke भी ऊपर जाएगा. So most common type centri-SNR भी ऊपर वाले lobes, upper lobes are involved. Smoking is associated. Pan-SNR, typically it involves the entire SNI and lower lobe. Lower lobe, please don't forget. Alpha-1 antitrypsin deficiency से आने वाला emphysema क्या होता है? Pan-SNR. Then paraseptal is distal part of the SNI, near the septum. Mainly it is subpleural, is what you need to basically remember. Fibrosis and atelectasis is paraseptal. Ashwin Maran is giving a good compliment. Sir, I have not seen anyone, any other teacher even doing half of what you do. Abba, homework diya or half the work is done. Very good. And I have not seen Maran, no other student who will do double, who will read double to what I discuss. The one and only Ashwin Maran. Very good. Now, doctor, parenchymal bodies, what are they composed? They are composed of iron. So, typically, this is how a parenchymal body look like. Kal ke image-based MCQ in the tomorrow's NEETPG, one question is going to come. There are clusters of dark blue granules, irregular in shape, composed of iron and ribosomal DNA. Sideroblastic anemia, hemolytic anemia. Classically, you see parenchymal bodies. Howell-Jolly bodies, once more. They also look very similar like a pigment. Smooth, single, large, round inclusion. It is remnant of nuclear chromatin. Megaloblastic anemia, hemolytic anemia, post-splenectomy, you find single Howell-Jolly body. Megaloblastic anemia, abnormal erythropoiesis, you see multiple Howell-Jolly bodies is what you need to remember. What is the genotype of Turner? Come on. Examiner joke karega aisa. So that he want to cheer you up. XO. Which syndrome is related to obesity? Cohen's syndrome. Bhaiya, what is Cohen's syndrome? Fatafat bolo. Hypotonia, characteristic facies, high arched palate, short philtrum, high nasal bridge, delayed puberty, hypogonadotropism. This combination is called as Cohen's, is what you need to remember. Calymatobacterium. What is the deal between us and the examiner? One of the STD puchega. Herpes simplex, chancre of syphilis, chancroid, lymphogranuloma venereum, granuloma inguinale. One out of these five, agar nahi hai to exam question paper, Monday को मैं भूख हड़ताल करूंगा, ठीक है? हाँ, Calymatobacter is what, doctor? It is a gram-negative organism, pleomorphic gram-negative bacilli, gram-negative bacilli. अभी आ गया क्वेश्चन डॉक्टर, फेवरेट क्वेश्चन. How much protein percentage cow milk is having over human milk? Cow milk is for cow's baby. Human milk is for mama's baby. They both are different. है ना doctor? So how do they differ? Come on. Punctuate answer, doctor. दूध वाला आ गया. Ashwin Maran is proposing 3 times. Mohan Babu also. अरे वाह, you're all like ready to, where is it? Fire करने के लिए तैयार है. So doctor, human milk has got lesser protein, lactalbumin to casein ratio 60 to 40, reversal in cow's milk. Sodium is more in cow's milk. Human baby cannot filter that much sodium in the kidney, that is too much osmolar load. Mama's milk is better. And iron is better in human milk compared to cow's milk, 0.5 milligram. Calcium is more in the cow's milk. Phosphorus is more in the cow's milk. That is what you have to emphatically remember, doctor. Right, Raghuvarma rightly says, human milk is the sweetest milk containing more lactose. Most common organ damage in blunt trauma क्या होता है डॉक्टर? स्प्लीन. भैया जरा इस स्प्लीन को देखो, इस स्प्लीन के सराउंडिंग एरिया में यहाँ है पूरा hematoma दिख रहा है ना? So spleen is most common organ involved in blunt trauma. Which insulin will you give in diabetic ketoacidosis, doctor? Which type of insulin? Regular insulin. मतलब ये सब irregular है क्या? But one point I want to once more re-emphasize to all you guys. Insulins, oral hypoglycemics. Insulins, oral hypoglycemics. There is about 30 to 45 minutes discussion which is made available in the online mbbs.com video library. Please take an opportunity to do the revision. Be very sure on that. Definitely आने वाला topic है. KOH mount. Where do we do, doc? Candida. So this is the typical KOH test where you are able to see the Candida, for which we do the KOH test. Recently FMG में हमने discuss किया ना डॉक्टर 2019 December में भी there are a lot of repetitions. Incidence of exposed divided by incidence of non-exposed, what do you call it as? Risk ratio. Risk ratio is different from risk difference. Risk difference. Risk difference means attributable risk. Risk ratio means relative risk. That is what you need to emphatically remember, doctor. So, exposed group, non-exposed group. Occurrence of the disease or non-occurrence. So, how many times the factor exposure would increase the incidence of the risk to an individual? That is called relative risk. How do you calculate that? Incidence risk among a exposed group, incidence risk among the non-exposed group. How will you get that? A by A plus B, C by C plus D. If the relative risk is more than 1, that means there is an increased exposure due to that particular factor. Risk factor is what you need to remember. Attributable risk is what? Incidence of the risk among the exposed group minus incidence of the risk among the non-exposed. इसलिए इसको बोलते हैं risk difference. Then what is odds ratio, doctor? Once more I am telling you, there are 250 MCQs in the past 15 years of all India NEETPG aims on biostatistics. हमने पूरा 8 hours में उसका गर्मा गर्म डिस्कशन करके YouTube में ही छोड़ दिया, हमारे YouTube चैनल में ही छोड़ दिया. टाइम मिले तो एक मर्तबा फटाफट रिव्यू करो अगर बायोस्टैटिस्टिक्स जरा शेकी लग रहे तो. Right? Now, what is odds ratio? The odds of exposure in a given case, odds of exposure in the controls. So, cases with exposure are A, cases without exposure is C. Right? Then controls with exposure is B, control without exposure is D. A by C divided by B by D will give you AD by BC, which is called as odds ratio, is what you have to be 100% sure, doctor. Normal anion gap, easiest, cheapest, biscuitest question in the entire entrance exam, doctor. Renal tubular acidosis. Already you know mud piles. Aspirin, methanol, uremia, decay, penaldehyde, ethylene glycol, they all lead to high anion gap. Normal anion gap, if you are losing bicarb into the GIT, like diarrhea, enteric fistula, pancreatic fistula, any diversion of the ureter, ureterosigmoidostomy, ileal bladder, ileal ureter, renal tubular acidosis, and any medication like carbonic anhydrase inhibitor, amphotericin B, even amphotericin B can lead to normal anion gap metabolic acidosis is what you have to emphatically remember. If the NEETPG exam is there without a question on acid-base disturbances, respiratory stenosis, respiratory alkalosis, compensation, metabolic, Everything you have to be 100% sure. Definitely आने वाला question है. Acid base disturbance. Entrance is not for 300, it is only 299. Here's what you need to basically remember. Shipra is saying, sir, can you discuss the maximum asked ECG? Someday or one day? Already you have a video, doctor. You have a video. हम जो पढ़ाते नेक्स्ट टाइम फिर वही क्वेश्चंस पढ़ाने में मजा नहीं आता. So already you have an extensive discussion available in the onlinembbs.com video library under 30,000 MCQs, hot MCQs, topic wise classified discussion folder. Kindly review, Shipra. Now, doctor, what are the causes of non-anion gap acidosis? HARDEPS. That is normal anion gap metabolic acidosis, hyperalimentation, acetazolamide, amphotericin, RTA, diarrhea, ureterosigmoidostrophy, post-hypocapnic state. Post-hypocapnic state. And any sulfur. Now, which immunoglobulin increase in Crohn's disease, in chronic disease? IgG. Abhi, once more, June परीक्षा में, December परीक्षा में क्या पूछा एग्जामिनर? IgM के बारे में पूछा, yearly बोल के. Very easy, doctor. Very easy to crack entrance. HCG level in choriocarcinoma become increased. Too much question, na? Cherry red discoloration. Where do you see? Come on. फटाफट answer करो, doctor. Cherry red discoloration. Who is going to give me the correct answer? Yes. Everyone is saying yay. 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 Oh, how can that be yay? D. Kittu is asking, sir, please discuss previous image based questions को एक मर्तबा रिविजन करो. करेंगे, क्यों नहीं करेंगे? जरूर करेंगे. So, doctors, carbon monoxide. This is the cherry red, doctor, cherry red color. So examiner कल के एंट्रेंस में क्या देता है, इसको इमेज बेस्ड क्वेश्चन बना के पूछेगा आपसे, भाई ये लाश किस पॉइजन के वजह से लाश बन गया बोल के. आपका आंसर क्या है? कार्बन मोनोऑक्साइड. You should recognize that this is cherry red color. I have color blindness बोले तो examiner accept नहीं करेगा. So this is the typical cherry red color is what you need to remember. Murli sir, please discuss which one, doctor? TH3NBE. What exactly is that? Okay. Now, doctor, a non-hypertensive lady get fluctuated BP during pregnancy. Non-hypertensive. इसको बोलते हैं gestational hypertension. अच्छा डॉक्टर, what is the definition of hypertension? Different types in case of NBE. Okay, National Board of Exams एक mock 2020 पेपर रिलीज किया क्या? अच्छा, देखेंगे definitely. Now doctor, chronic hypertension. If the BP elevation is more than 140/90 before 20 weeks and persists more than 12 weeks postpartum, then you call it as chronic hypertension. Oh, okay. Definitely, I'll look into those 20 questions. Gestational hypertension. If the blood pressure returns to normal by 12 weeks, कल के एग्जाम में definitely पूछेगा examiner. Returns to normal by 12 weeks, you call gestational. So, maternal diabetic blood pressure, अगर diastolic blood pressure, अगर more than 134, diastolic blood pressure is more than 110, then that will increase the risk of abruptio. IUGR is what you need to remember. Now, most of the times, when do you detect the gestational hypertension, doctor? Between 24 and 35 weeks, you will develop preeclampsia. Preeclampsia. So, those who have gestational diabetes, those who are detected gestational hypertension, 50% of them will end up in preeclampsia, is what you need to basically remember. Now, blood spillage on the ground. How do you clean? Once more, doctor. Disinfectants. Chudega nahi examiner. Sterilization, disinfectants. Nagredi sir, next 3 days we will spend more and more amount of time in discussing these most recent questions instead of the grand test discussion. So just bear with me. So now, sodium hypochlorite. Once more, examiner is going to ask the same question, right, doctor? Now, sure, we will discuss 2020 JIPMER and AIMS, definitely. 2019 JIPMER and AIMS. Now, chronic malnutrition, how do you assess, doctor? Height for age, over a period of time, if you are not eating food, height will not come, so height to age. Tissue bridging, where do you see that? Question number 28, punch your answer, doctor. Yes. Question number 28. Goyal is proposing laceration. Sarah Khan also. Absolutely, doctor. Bhaiya, laceration क्या होता है? Tearing of the tissues which are bridging, there will be a tissue bridging from the blunt force trauma. So this is called tissue bridging. दिखाई दे रहा है ना? The wound has rough edges and tissue is not fully cut. That is how you will identify tissue bridging. Once more, doctor. One of the favorite questions of the examiner. Please don't forget. Peritonsillar abscess, parapharyngeal abscess, retropharyngeal abscess. One question puchega. Today morning only we discussed in FMGE, right? Now, what is quinsy, peritonsillar abscess? This is another gold mine question, definitely आने वाला question. Ready है ना आप सब लोग? Surface antigen positive, envelope antigen positive. So, hepatitis B serology, doctor. Window period में क्या होता? Chronic active hepatitis में कैसे रहता? Vaccination के बाद कैसे रहता? जरूर correctly answer करना आप. Very important. So, doctor, surface antigen is positive. That is the reason it is acute. Envelope antigen positive. That is the reason it is infective. Is what you need to basically remember. Which receptor is activated in hypercapnia? Chemoreceptors are the ones which are basically activated. अब भी आ गया बट्टी मारने वाला, ट्रिटियम का हाफ लाइफ बोलो, मैं तुझे एमडी जनरल मेडिसिन का सीट देता हूं, नहीं तो एमडी गाइनॉप्स का सीट देता हूं. गाइनॉप्स में डिलीवरीज करने को और ट्रिटियम को कुछ संबंध है? नहीं है. फिर भी एग्जामिनर पकड़ेगा कान. नाउ so yes doctor, Ayush is asking, sir ये क्यों ये कौन सी क्लास का लेक्चर है? ये क्लास 17 का लेक्चर है. 17 क्लास का लेक्चर है. मतलब 10th क्लास के बाद 11th 12th के बाद एमबीबीएस में ज्वाइन होते ना, 5 साल पढ़ने के बाद 17th क्लास को आते हैं. ये 17th क्लास का लेक्चर है बेटा. बाय मिस्टेक नीट को देख के आप 12th क्लास स्टूडेंट केम इनटू 18th क्लास you need to be little sure about. So, doctor, 12 years. So, hydrogen 3 is called tritium. It causes beta decay, 12.3 years. Beryllium, alpha decay, carbon 14, beta decay, iodine 131, beta decay, 8 days. Remember. Then cobalt 60, beta plus gamma, 5.2 years is what you need to remember, right? So this is important, doctor. अभी 18th class exam में जरूर पूछेगा examiner. अभी annual exams है हमको 18th class का. Half life of various radioactive isotopes you have to be very, very sure about. Now, papillary thyroid cancer in a pregnant female. Pregnant female को radiotherapy नहीं देते ना doctor. Remaining things are all true. Maintain maternal thyroxine, maintain calcium, perform safe follow-up. Right, doc? Now, which is a marker of pheochromocytoma. Just before evening, एक स्टूडेंट ने व्हाट्सएप किया, सर इतना टेंशन आ रहा है, इतना टेंशन आ रहा है. I said, what is the severity scale of the anxiety and tension? कुछ कानों से hot waves आ रहे हैं तो grade 2, right? Even from nose you are getting means grade 3. From mouth you are getting smoke means grade 4. So कितना गर्म है tension? So doctor, I want to tell you, I want to give you one WhatsApp phone number. मैं आपको एक WhatsApp phone number देता हूँ. टेंशन आए तो चैट करो मेरे साथ. कैसा है डील? 24/7 I will be available to chat with you. 1 minute, doctor. 24/7 I am available to chat with you. No worries. So one number है doctor, 9100039974. ठीक है? 39974. चलो मैं अब भी देता हूं आपको 9100039974. Call me anytime you feel tense, you want to learn strategy, you want to know what stage I am and how can I move forward. I promise to be available with you, doctor. Okay? I promise to be available with you to chat with you. If I'm awake, I will chat with you. If I'm sleeping or if I'm with a patient, I don't know, but definitely I will be available, right? That's right. Bianca or anyone, if you are not good in anatomy, you are not good in physiology, what to do now? Ask Murali Bharadwaj. I will be available to chat with you. Okay? So you can tell your friends also. The role of a teacher is more to hold your hand to take you forward in the right direction, to give you the required courage and make you bold to swim. Ultimately, you need to swim. That's the only role of the teacher, doctor. So let's take opportunity to open up a 24/7 chat line where we will be available to help you to text chat only. Talking is difficult, text chat. Anyway, you are seeing me talking all the day, right? Now, nephrotic syndrome. What can lead to nephrotic syndrome? Focal segmental, membranous, minimal change disease. Once more, without a question on glomerulonephritis, there is no question paper. Be very sure, doctor. 40-year-old male with dry gangrene on the legs. He is a chronic smoker. What is the condition called as thromboangiitis obliterans? Thromboangiitis obliterans. It is not Berger. इसका दूसरा नाम क्या है? बुर्जर. अरे ये बुर्जर और बर्जर डिफरेंट है, डोंट कंफ्यूज. एग्जामिनर ऐसे छोटे छोटे फनी क्वेश्चंस होते हैं, वेरी फनी, राइट? सो बुर्जर कबाब बर्जर कबाब भाई भाई है, और बुर्जर इज लाइक भीमो, बर्जर इज लाइक सोमो. सो बर्जर कौन है भाई? बुर्जर तो थ्रोम्बोएंजाइटिस ऑब्लिटरेंस है. आईजीओ नेफ्रोपैथी को बर्जर बोलते हैं. अच्छा, नाउ डॉक्टर, IgA nephropathy is 2:1 male to female. Most common lesion found to cause primarily glomerulonephritis. Typically, what will be the history in case of IgA nephropathy? Sore throat within 48 hours, hematuria. इसलिए इसको क्या बोलते हैं? Synpharyngitic hematuria. Unlike post-streptococcal glomerulonephritis. PSGN में क्या होता? सोर थ्रोट के बाद हिमैचुरिया होता, मगर 3 to 4 weeks के बाद होता. मगर IgA nephropathy में pharyngitis today, and by NEETPG exam day there is development of hematuria, right? So that is what you need to remember. Now doctor, hematuria lasts for several days, then subsides, but it recurs. And renal functions are very well maintained for decades. But if you do renal transplantation, even into that also, this IgA nephropathy will recur. It is slowly progressive. These are the key points about IgA nephropathy. Now, doctor, which is a non-iodinated contrast? एक कुछ क्वेश्चन है क्या? कुछ भी नहीं है इसमें. Probably what is more difficult question waiting? This is like a Herald patch. NEETPG में you will get full Christmas tree pattern questions. What is the bigger question waiting? Which are ionic, non-ionic among the iodinated contrasts? You should know the classification, right? So अभी gadolinium is not iodinated. Iodinated contrast material. बड़े वाह, हम बहुत खुश हैं. 172 online students. Doctor, we should touch that 300 before NEETPG day. That is the promise, right? Now, iodinated contrast can be oily, non-water soluble, or it can be water soluble. Water soluble typically can undergo renal excretion. That can be low osmolar, high osmolar. High osmolar is ionic monomers like iothalamate diatrizoate. Whereas low osmolar can be ionic dimer like ioxaglic acid and non-ionic monomer like metrizenamide, non-ionic dimer like iotrol. They're all low osmolar. Then if it is a non-water soluble, then it will be hepatically excreted, and that is iopenoic acid is what you need to basically remember. So doctor, diatrizoate, metrizoate, then ioxaglate, they are all what? Ionic. Iopamidol, iohexol, iodixazole, they are all non-ionic is what you need to basically remember. Now doctor, rodent ulcer, basal cell carcinoma, vision 2020 में what is not included? Who is going to give me the correct answer? Come on. Punctuate answer, doctor. Which is not included in Vision 2020? फटाफट बोलो. Yes. Deepika is saying trachoma. Life is good is saying corneal blindness. Ah. Doctor, trachoma, cataract, refractive error, childhood blindness, recently glaucoma, diabetic retinopathy, they're all the target diseases under Vision 2020. Right? Now, doctor, chest compression in adult, क्या होता है? Paper 2019 December paper. Right? FMG 2019 December में he asked कितना depth will you do the compression? Earlier it used to be 2 inches in adult, now it is made 2.5 inch. That's what you need to remember. So, a lot of times the house surgeons, interns, first time when they do the CPR, no, they will do it very smoothly like a thigh massage. Patient will be dying like a thigh sandwich massage, slowly they will be doing. So there is certain recommendation, how intensely you need to do, how deep you need to do, what frequency you should do, everything, that protocol, you have to be 100% sure, doctor. Now, sensitive person, he get affected easily, he has difficulty in controlling anger and he does not meet people, interpersonal relations are screwed up. What is that called as? That is called borderline personality. चलो डॉक्टर, एक पर्सनैलिटी डिसऑर्डर डेफिनेटली आएगा. You should know based on the clinical vignette how to recognize it. अभी मैं पूरा पर्सनैलिटी डिसऑर्डर्स को फटाफट बोलता हूं, आप बताओ which personality disorder I am having, you are having, right? Identity crisis, relationships are unstable, abandonment, impulsivity, suicidal gesture, मैं मर रहा हूं, with multiple blade cuts, emptiness, dissociative symptoms, mood instability, paranoid ideation, anger is poorly controlled, right? And negativistic, self-defeating behavior. वो क्या होता है डॉक्टर? Borderline personality disorder. Schizoid, मुझे शर्म लगता है, मुझसे बात मत करना please, right? Schizoid personality disorder. What is it? Solitary lifestyle, indifferent to praise or criticism, relationship of no interest, and sexual experiences no interest, sorry, nothing to offer, activities not enjoyed, lack of. How will you get friends if you are a schizoid? Emotionally cold and detached. माँ मर गए, okay. PG में सीट आ गया क्या? Okay. So that is schizoid personality. Now, schizotypal personality, वो क्या होता है? Unusual perception, friendliness except for family, odd beliefs, odd thinking, odd speech, inappropriate affect, ideas of reference. सब लोग मुझे बोल रहे हैं कि मैं टॉपर बनने वाला हूं बोल के सब लोग बात कर रहे हैं. Doubts others, eccentric, that is all schizotypal personality. Paranoid, doubting Thomas, grudges held for long periods. Was that day in the reading room you told me, Noah, that I will not get PG seat? That guy will remember for next 20 years, right? That guy will remember up to next 20 years, be very sure. Now, fidelity of sexual partner questioned. Attacks on character, paranoid. Then avoidant personality disorder. The main challenge in the tomorrow's exam comes is How do you differentiate schizoid from schizotypal from avoidant personality disorder? We discussed all that in a more greater detail in the onlinembbs.com video library, doctor. Please review. Dependent personality disorder. ए रामू तुम नहीं आए तो मैं गीता नहीं आऊंगा रीडिंग ग्रुप को. अगर तुम लेफ्ट साइड ऑफ हैरिजन में पढ़े तो मैं राइट साइड ऑफ द हैरिजन का पेज पढ़ूंगा. अगर तुझे सीट आए तो मुझे सीट आए तो तुझे नहीं आए तो मैं ज्वाइन भी नहीं होऊंगा. So that is what dependent personality disorder, right? Narcissistic personality disorder. Guys like Dr. Murli Bharadwaj. पूरा दिखावा 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 रहना है, right? Arrogant, manipulative. Oh, I'm not envious. Unlimited success they fantasize. Admiration required in excessive amounts. सर आप बहुत अच्छा लेक्चर देते हैं बोल के अगर आप दे दिए तो मैं पूरा रात पढ़ाई करके आपको पढ़ाई दे दूंगा, right? So little appreciation will blow me to remain until the last breath to keep teaching you, right? Grandiose sense of importance. I am the richest man in the world and most knowledgeable. Associates with special people. Me first attitude. Oh, that is also not there, right? Empathy lacking for others. Tu mar rahe kya? Maro. Tu marne ke liye paide hue ho. So that is narcissistic. Fame, game is all narcissistic. Histrionic personality. I crave for the sin. Inappropriate behavior which is very seductive. Hello doctor. Oh, you are the doctor? Oh, I'm also a doctor. But I'm an animal doctor. I have animal desires. Do you like to meet me? So that is what? Histrionic personality disorder. He or she should be the center of attention. Appearance is most important. They are vulnerable to other suggestions. Emotional expression is exaggerated, right? And novelty is great. That is the typical histrionic personality. Right, doctor? So, कितना सब लोग I mean, it is so easy to, we lost power in the home, doctor. Yeah. I won't be visible because there is no power. Yes. But still internet is on. I think we can continue. You are able to listen, right? So, doctor, what will be the choice of treatment when a 65-year-old man with carotid artery stenosis develops severe depression and hypersomnia? We give nortriptyline. So, doctor, basically, tricyclic antidepressants, antidepressants का classification एक मर्तबे full final settlement before exam. Tricyclics, MAO inhibitors, SSRIs, dopamine, norepinephrine, reuptake inhibitors, mood stabilizers. That is what you divide. Fatafat. Now, imipramine, doxepin, amoxapin, nortriptyline, amitriptyline is all tricyclic. Then phenylazine, moclobamide is MAO inhibitors, fluoxetine, sertraline, citalopram, escitalopram, SSRIs. Bupropion is what? Dopamine, norepinephrine, reuptake inhibitor. Lithium is the mood stabilizer. So SSRIs, SNRIs, serotonin receptor antagonists, MAO inhibitors and TCAs. You have to be 100% sure, doctor. Now, how do these tricyclics differ from one another? That is important. ट्राइसाइक्लिक से मेन प्रॉब्लम क्या होता है डॉक्टर? मेन प्रॉब्लम क्या होता है? ट्राइसाइक्लिक से मेन प्रॉब्लम होता है एंटीकोलिनर्जिक इफेक्ट. Is the broadcast is happening smoothly, doctor, for everybody? Yes. Now, typically, nortriptyline has lowest anticholinergic effects like drying of the mouth, blurring of the vision, etc. Hypotension is lowest with nortriptyline. Cardiac effects are lowest with nortriptyline. Seizure tendency is lowest with nortriptyline. Nortriptyline is the novel tricyclic antidepressant, is what you need to remember. Sodium fluoride inhibits enolase. Now, which part of the breast, development of which part of the breast you require progesterone? A very, very important question. Come on, shoot your answer, doctor. Let me check how good you are for the tomorrow's NEETPG. Nayamoni is proposing D. Deepika is also proposing D. Prasun Vaidya is proposing ligaments. Ow. Vaidya, do wrong, but don't do so wrong. Oh, you're all sticking on Dutch, sir. Mullai Vandan is proposing lobules. Okay? Ye dekho, doctor. Estrogen growth and branching of the ductal system, along with growth hormone and fat deposition in the stroma. Estrogen. Progesterone, growth of the lobulo-alveolar system, budding of the alveoli and secretory changes in epithelial cells. That's the reason I'm strongly thinking progesterone is associated with lobular development. Okay? So, typically, immature atrophic ducts, estrogens and adrenal steroids together will make the ductal growth to develop. Then progesterone help for lobulo-alveolar growth. Then prolactin will help for milk secretion. That is what you need to appreciate. So what do you see in catatonia? We see echolalia. So be very careful with echolalia. If your echolalia patient is in the ward, just like that, you give a good compliment to your nurse. Hey, Sister Lily, you really look so sweet, and today you look good. Then that fellow continuously keep on telling, even when your professor is doing rounds, hey, Sister Lily, you look so beautiful, so flushing. Continuously he keeps saying like a parrot. Then HOD will ask you, who is that resident who is eyeing on my girl, right? So, tell me, doctor, what are the various things in DSM-4? Mutism, refusal to speak, the strongest weapon for you to fight with your fiancé. Immobility, I will not come to the marriage altar. Immobility, lack or paucity of movement. Stereotypes, purposeless repetitive movements, like in the reading room, kuch log, they keep on waving that foot. You will say, please don't do that. In fact, reading room is like a psychotic asylum, right? Then negativism, passive refusal to follow command. Mannerism, repetitive, purposeful movements. Then purposeless repetitive movements are called stereotypes. Purposeful repetitive movements are called mannerisms. That's what you need to understand. Grimacing, repetitive facial posturing. Catalepsy or waxy flexibility. Same posture में बैठ जाते. Morning reading room को आते ही बैग डाल देते. और seriously, they don't even sit in the middle. Straight wall के opposite में बैठते हैं कुछ लोग. Keep on studying, underlining busily, right? You will be wondering when this fellow's bladder will fill and when will he go for at least washroom. He won't even get up. Exactly 1 p.m. afternoon they get up for going food and coming. That is one type. Another type, कुछ पढ़ते ही नहीं. आते ही बैग डालते, बाहर जाते, अंदर आते, बाहर जाते, अंदर आते. Oh my God. So, I'm missing all that reading room days, doctor. Right. So, ecopraxia, echolalia, that is repetition of the words or imitation of actions. They are all the various things. So, what is the DSM-5 criteria for catatonia? Stupor, catalepsy, flexibility, mutism, negativism, posturing, mannerism, stereotypy, agitation, grimacing, echolalia, ecopraxia. That defines catatonia. Now, doctor, long-acting insulin, which does not have a peak, that is a peakless insulin, which is the glargine. Abba, एक IPC, my lord, one IPC question आएगा, without that there is no paper. Come on, let me check how much of you are legally prepared. Yesterday, what was the IPC question in December FMG paper? McNaughton's rule, section 84. इसका आंसर करो, right? You answer this question. Now, Dr. Abhilasha is proposing 312. Indira saying 313. Right? So, 313. कौन बोला? जस्टिस इंदिरा. इंदिरा नाग रेड्डी साहब 2 सब्जेक्ट्स में बहुत स्ट्रांग रहते. They are ruling the primary health center, so that is the reason. Legal एक बात और preventive medicine. I am very sure you will score 30 plus 10, 40 out of 40 in these 2 subjects, Nagreddy and Indira. I wish good luck. So, doctor, it is 313. Bhaiya, 312. Anyone voluntarily causing a miscarriage to a woman with child, other than in the good faith for the purpose of saving her life, right? Good faith for the purpose of saving her life. Other than that, any miscarriage caused is punishable by imprisonment. Then 313 to 316 for the death due to procedure, 10 years imprisonment and fine extending to life imprisonment when the abortion is conducted without consent is what you need to remember. That's right, without blessings. With your blessings, sir. Okay. Patient ka bhi blessing rehna. Consent of the patient is a blessing. That's what I was thinking. Okay, good. Definitely, doctor, definitely. पूरा दुनिया को नीट पीजी में टॉप रैंक आना वन हैंड. हमारे नागरेड्डी साहब और प्रियदर्शनी को, इंदिरा प्रियदर्शनी को आ गया तो I will open a champagne in a Lamborghini, right? So, doctor, delirium. Delirium has a sleep disturbance, psychomotor disturbance, sundowning phenomena. They're all there. Now, doctor, delirium versus dementia versus depression. Favorite question of the examiner. Onset of the delirium, hours to days, acutely. Dementia is more insidious course. It is fluctuating in delirium, progressive in dementia. Duration, hours to weeks is delirium, consciousness altered, attention impaired, and usually reversible. So that is the point you need to basically remember. Now, doctor, a patient on mechanical ventilation, ventilator shows an alarm with increase in both peak and plateau pressure during inspiration. Recently, हमने FMG में 100 MCQs है last 15 years का FMG MCI screening test का, उसका discussion करके YouTube में ही छोड़ दिया, right? So, if we leave a video on YouTube, don't think we are very generous, doctor. It is actually we are advertising. आओ भाई हमारे पास subscription ले लो बोल के. So that is the reason we are absolutely commercial. Now, doctor, obstruction of the tracheal tube. So you should remember, peak pressure is what it generates when the air flows. Peak pressure is equal to stiffness of the lung plus chest wall compliance plus resistance. Then plateau pressure is when the air stops. Hence, it is a measure of lung compliance. And it is affected by the chest wall and lung parenchyma. So, peak pressure minus plateau pressure generally is less than 5 millimeters of mercury. Please don't forget. Very good. Sarah, thanks for the compliment. So, doctor, this is the peak inspiratory pressure and you are able to see the plateau pressure. So what situation may peak pressure become high, plateau pressure become low, and what situation peak pressure is high, plateau pressure is also high. So mucus plug, bronchospasm, ET tube blockade and biting will lead to peak high, plateau low. Whereas ARDS, pulmonary edema, pneumothorax, ET tube migrated into a bronchus and effusion, they lead to high peak and high plateau. Abhi kya bola? Both peak and plateau pressure. So, if the ET tube is blocked, no, it should lead to high peak, low plateau. So, what are the other options? So, I feel obstruction of tracheal tube means ET tube migration into the single bronchus. That must be there in the examiner's mind. Now, which is not a tumor marker for testicular carcinoma? Favorite question of the examiner. Come on, punch your answer, doctor. Good to see 187 online. Another 13 low. 200 double ton delivered by Rohit Sharma in the cricket, like that. So please tell your other friends also. Now, doctor, question number 15, punch your answers. Everyone is saying FSH. अच्छा क्वेश्चन बनाते मगर ऑप्शंस टू इजी देते, राइट? So we should remember alpha-fetoprotein, HCG, LDH. Raised alpha-fetoprotein is seen in pure embryonal carcinoma, teratocarcinoma, York sac tumor. HCG, typically it is raised in choriocarcinoma, embryonal carcinoma, York cell tumor. LDH, it is elevated in 50% of seminomas at the time of presentation. LDH seminoma. LDH seminoma is what you need to remember. But one thing you need to remember, doctor. One thing you need to remember. AFP is never raised if it is a pure choriocarcinoma or if it is a pure seminoma. अगर वो प्योर बोले तो sometimes it comes like a mixed, right? Pure choriocarcinoma, pure seminoma, AFP is not raised. That is the point you need to remember. Which cancer you get in Barrett's, adenocarcinoma, Hoffman degradation, atracurium, exercise intolerance with the muscle cramps, which glycogen storage disorder, doctor? McArdle, why? McArdle is because of deficiency of muscle phosphorylase deficiency, lead to McArdle. One more thing, what shall I remind you, doctor? A very important thing that I want to remind you. Is the broadcast okay or is it stuck up? Is the video stuck up, doctor? So, McArdle's disease is muscle phosphorylase deficiency. Oh, okay. 1 minute, doctor. Uh, I will restart broadcast. Please be online. Please be online. यस डॉक्टर, कभी कभी जरा लोड गिर गया तो यूट्यूब वाले डर जाते, राइट? हाँ. Exercise intolerance with muscle cramp. Where do you see, doctor? We see it in McArdle's disease is what you need to remember. So if you have done this question wrong or if you are a little woozy, doctor, don't forget. Glycogen storage disorder, top 20 topics out of 50 topics that I gave you in biochemistry, in the descending order of priority में glycogen storage disorder है, उसका नामा एंजाइमा पूरा याद रखना, right doctor? Now McNaughton's rule is criminal responsibility and insanity, as all of you know very well. Malignant hyperthermia, ryanodine receptor. Once more, what are the agents which are safe in malignant hyperthermia, which are unsafe in malignant hyperthermia? गर्मा गर्म पूछता है examiner. Which is a uncoupler of oxidative phosphorylation? Once more मैंने बताया ना डॉक्टर, इलेक्ट्रॉन ट्रांसपोर्ट चेन. आज सुबह भी मैं बताया आपको, डेफिनेटली आएगा वन क्वेश्चन इनहिबिटर ऑफ complex 1, complex 2, 3, 4, pura bativana. So it is 2,4-dinitrophenol, which is the uncoupler. Which vitamin will help in iron absorption? Vitamin C. Most common site of Fordyce's spots. Ditto in once more December 2019 FMG exam. Lips के ऊपर रहता है. In intestine, the glucose is co-transported by SGLT1 is what you need to remember. So doctor, both SGLT1 and 2, typically they lead to sodium influx. Now, SGLT2 is low affinity, high capacity. SGLT1 is high affinity, low capacity. If you inhibit the SGLT2, it results in glucosuria. So what are those drugs which inhibit the SGLT in the kidney, doctor? Canagliflozin, dapagliflozin, empagliflozin. They're all inhibitors of SGLT2. If the SGLT2 is inhibited, it will lead to excretion of glucose, decrease in HbA1c, weight loss. But what is the main side effect of SGLT inhibitors, doctor? SGLT inhibitors के वजह से क्या हो रहा है? Glucose is entering into renal tubular fluid and into the urine. That's the reason urinary tract infections become very common if you happen to inhibit SGLT is what you should remember. Farmer's lung is caused by, typically it is the immune complexes. So you get a hypersensitivity pneumonia. So moldy hay lead to development of the farmer's lung is what you need to basically remember. Moth-eaten alopecia. मुझे मालूम है, you are all waiting for this question. Secondary syphilis. Don't tell me primary. Secondary syphilis. Once more, doctor. Alopecia na favorite topic of the examiner. All NEETPG paper setters will have a good significant problem of male pattern alopecia. So be very sure. Alopecia areata, anagen, telogen, ketogen, all this effluvium, you have to be 100% sure. You're going to promise me? Because already we discussed the last 15 years FMG, dermatology we discussed kar chuke. Right, doctor? So just be online, I'll just download. हमारे लोग like a printing press न्यूज़पेपर वाले मैं रेडी करते हुए वो फटाफट पीपीटी बनाते. So they might have prepared the PPT. I'll just load the PPT, doctor. So please be online. Just 1 minute. We will download the. Today I planned about 130 questions. Another 30-40 minutes. We will finish 130 questions. Go to sleep. Morning we will wake up, and then we will take up around 200 questions. Right? Pura din I keep preparing, calling you for a discussion. जिपमर का पेपर डिस्कस करेंगे 2019 वाला, right? Then AIMS का May 2019 AIMS already we discussed and made it available in the YouTube, so no worries. So before the PPT downloads, let me once more tell you, doctor, that just identify those tables, those points that you have painstakingly written on your chota mota notes पे शांति से वो revision करो, more than enough, right? Now, doctor, sir, on a side note, can we view the past live sessions on YouTube? Are all of them available? No, they are all not available, doctor. We are commercial, no? We are very pakka commercial. You have to enroll into online MBBS video library where we make available everything. But still you can do one thing, you can call our helpline. A 3 दिन के लिए you get a free pass, right? So that if you get seat, you acknowledge that we helped you. And 1 minute, doctor. I'll just one minute, doctor. I'll just find out our guys whether they have sent the PPT. Just I will log out and then log in back. Please stay online.